Peter Block in Orlando at the AHA annual meeting for On the Scene, and with me is John Teerlink from San Francisco. John has been working on for a long time, John, a new drug which is not a catecholamine like inotrope. But in any case, John, tell me about this new drug and this rather exciting study, because it may be a new frontier.
Sure. Thank you so much, Peter. I'm going to be talking about omecamtiv mecarbil. Omecamtiv mecarbil is a cardiac myosin activator, and in so doing, it increases the transition rate from the weakly bound actin-myosin complex to a strongly bound actin-myosin complex. It's a very complex way of saying that, in effect, there are kind of more hands pulling on the rope of actin, increasing cardiac function. And you mentioned that it's not a classic inotrope, and it's very different than the typical inotropes such as milrinone and dobutamine. This agent, omecamtiv mecarbil, does not increase intracellular calcium, does not increase intracellular cyclic AMP, and in vitro and in vivo studies has shown no increase in arrhythmias or ischemia or other adverse effects that are typically along with those other agents.
Okay, now that we've confused everybody with all of this basic science stuff, tell me about the study, because the study actually is quite a clinical one, isn't it?
Oh, absolutely. Cosmic HF was a 448 patient phase 2 study that looked at a modified release formulation of oral omecamtiv mecarbil. It was administered to patients with reduced ejection fractions who had some elevated natriuretic peptides, who were optimally treated with medical therapy, and randomized in a 1-to-1-to-1 basis to omecamtiv mecarbil at 25 BID, omecamtiv mecarbil at 25 transitioning to 50 with a pharmacokinetic adjusted dose, and then versus a placebo. And the patients were treated for 20 weeks and followed by pharmacokinetic measurements as well as serial echocardiography.
Okay, that really is the endpoint here, isn't it, John? Because what you told me when we were talking about this before all this began and the interview began was that left ventricular function did improve. So tell me in a short version what you found.
Absolutely. We saw increases in systolic ejection time, which is the pharmacodynamic signature of omecamtiv mecarbil, increases in left ventricular stroke volume, ejection fraction, and fractional shortening. And these were associated with improvements in left ventricular dimensions as well as volumes, and associated with the physiologic finding of an improvement in heart rate and a substantial and statistically significant reduction in NT-proBNP. And I know we don't have time to go into specifics, but all of these were statistically significant.
And the other good news about this is that the ejection fraction, which is the kind of thing that we look at in the cath lab and in the echo as clinicians, also improved. The signal here is rather exciting. What's the downside, if any?
Well, so we were very encouraged to see that there were no changes in adverse events or serious adverse events. However, there was, once again, and this is consistent with a prior study as well, a very small but real increase in troponins, and this is on the magnitude of 0.006 to 0.007 nanograms per ml. And this is consistent with what endurance athletes get after major endurance activities. We are taking this seriously, but also don't know what to make of it, because it's the first time that we've ever seen troponins go up in the face of NT-proBNPs going down, myocardial function getting better, and dimensions getting better.
And heart rate coming down.
And heart rate coming down. So,
well, exciting stuff, and obviously you're going to go for a larger trial. I mean, it is quite clear you need a large randomized trial, multi-center, and that may show you exactly what you want to know.
Absolutely, and we're looking forward to pursuing that kind of phase 3 study where we'll be able to really truly evaluate the risk-benefit profile of omecamtiv mecarbil in patients with chronic heart failure.
Well, keep your eye on this drug. This is something that is really probably coming. It's a brand new way to deal with heart failure, and I will wish you luck with your big trial. It would be really exciting if this worked out. Thank you very much, John.
Thank you.